Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hey everyone, welcome back to Friends with Fertility. Today we have Dr. Mandy Dell. Welcome, Dr. Mandy.
Hi.
She is a doctor in clinical nutrition, root cause investigator, and founder of IC Healer and DrMandyDCN. With both personal experience and extensive client success, she specializes in optimizing mitochondrial health to support fertility and overall wellness. Dr. Mandy blends cutting-edge nutritional science with a functional approach to help individuals uncover the deeper dividers between chronic health issues. Drivers, I should say. I am so interested in mitochondria health. I'm not sure exactly why I got so into this the last 2 years, but I feel like I love to geek out on this. So I'm really excited to have you here. For those that are listening, can you tell us what that even is?
Well, inside your cell, there's a little organelle. So I teach biology too. So I have to teach kind of in the biology level. So you might remember from high school biology, we have the nucleus and endoplasmic reticulum. And I always tell my students the mitochondria are my favorite organelle, even though the nucleus is super important too, because it's who you are. But without the mitochondria, you wouldn't be here because that's what gives you energy. That's what produces something known as ATP. Adenosine triphosphate. It's a molecule in your body that is just, it gives you energy. And that's how, you get up and you do things and your ability to think and your heart to pump, you need ATP. And this ATP is really high when we're young. That's why, I have an 8-month-old and I always watch him. I'm like, you have a lot of ATP because he just doesn't stop moving. And his ATP is really high. And then as we get older, we slow down because we're not producing as much of it. So that's the mitochondria is responsible for making that happen.
Okay, and how does that relate to fertility?
Well, because the egg cell has about, I think I read 100,000 mitochondria in them. So when the cell division occurs during fertilization, you need that energy in order for the division to happen appropriately. Now, a lot of that division is driven by the nucleus. So obviously there's a lot of things happening within the nucleus for the division to occur, but you need the mitochondria to power it. So if we have mitochondrial dysfunction, we may not do it properly, and that's when we can have problems with the actual division itself, which is known as non-disjunction. That's like when we have in IVF world that they call them aneuploid, right? The embryos are aneuploid because they didn't divide properly, and then they have chromosomal errors.
I feel like this is somewhat of a new conversation being had in fertility, even though it's not new. The patients that are going through fertility don't normally feel like they're having that conversation brought to them from their doctors to say, maybe we should look at your mitochondria and how this plays a role in that. Why do you think that is?
I think traditionally with fertility, I think their fertility doctors may be just thinking of the basics such as hormones, egg quantity. So that's where they measure the AMH. A lot of times they really, really hammer that home, although we know that's not the end all be all because you can have a low AMH and have really good egg quality. So quantity isn't always equivalent to quality. But I think that because that's how their box is, and I mean, that'd be a great conversation for a fertility doctor to ask them, why don't you pull this into the picture? But from my experience, that is all they think about. So really, they're really only looking at AMH, age, and sometimes they'll look at hormones. Yeah, I think they look at the hormones, but not to in depth like a functional medicine doctor would. So a functional medicine doctor might run a different test. Like they may not do blood work. They might do like a urine test, like the ones we like to use, like the Dutch hormone test, which just gives you a lot more information than just a simple blood test. And I just think, to be honest with you, I think that's just how they're trained. I don't think they're trained in this. Maybe that's the problem.
Yeah, yes, you are right. And I do think that it's becoming, like I said, more of a conversation. A lot more of the conversations happening in Europe. So if you are somebody who finds yourself struggling about to find information regarding mitochondria, I know they're doing a lot more research in Europe and as far as actually making it happen there as well. So I would suggest you to go, for people who are looking for this, to go find more information over there than the medical doctors here, unfortunately. Dr. Mandy is right. Why do you think that it's fertility over 40 is coined as the issue with, at least in America and worldwide for that matter, but I think it's more so here with it being a problem with people with their egg quality over 40?
Well, I mean, they say you're born with a certain number of eggs, although I think some of the newer evidence says that you can actually make eggs throughout your life. But things do slow down. I think mitochondrial dysfunction does play a role in that because your mitochondria does decline with age. I mean, that's just natural. So there's let's just like kind of separate what really happens with age. With age, we definitely see a decrease in growth hormone. Okay, that is like you can look at growth hormone with age. We're peaked in our 20s and they levels tank after about 40. And then by the time you're in your 60s and 70s, that's why we lose muscle. That's why we get frail. So that's one thing. Hormone levels decline. We're not ovulating as regularly. So that could be also a problem too. A lot of women in America do enter perimenopause a lot earlier than we used to. So we'll have people who are already having perimenopause symptoms in their late 30s. There is a lot of factors that play a role in that. I think besides genetics, you should always ask your mom, when did you go into menopause? Because that's going to help you determine when you'll go into menopause. But we have environmental factors here. I think worldwide now, I don't think it's just exclusive to America. We have endocrine disrupting chemicals. We have a lot of plastics are being used. We have medications that people take. There's pesticides and herbicides that are being sprayed in our food. And then I hate to say it, but we all probably live in a house at one point that had mold in it because our homes are little mold factories, unfortunately, because of the way the building material that they're using for modern homes. I mean, one storm and you can have mold in your house. I mean, I literally have some in my son's shower because I have a 14-year-old as well, and he takes 2-hour long showers, and we have mold in the bathroom now. So this is the problem. And I think that there's another thing that we're not taking into consideration, which is my scope of practice. We're not eating properly. And so because of the food is garbage that we're putting in our body, we're not getting the nutrients that we need to fuel the Krebs cycle. Let's go back to biochemistry now with the Krebs cycle, the citric acid cycle. That's where we make that ATP. All that happens within the mitochondria. So the mitochondria itself can be damaged. The actual organelle can be damaged from things like chemicals, mold, pesticides. Also, there is also another layer I should add into that we can talk about if you want to, is oxalates that are in our diet. That's a whole nother thing that came upon my attention. I've been thinking about oxalates for years because of bladder pain, but now it came into the fertility world. And then on top of it, we aren't getting the vitamins and minerals to fuel the Krebs cycle so it can go through the electron transport chain and make energy. So maybe what's happened is we're creating a mitochondrial dysfunction environmentally, and therefore we're going into fertility struggles earlier than we're supposed to be. Because then people used to have babies in their 50s back in the day, right?
There are still people that are in different parts of the
Yeah.
world, I think. Well, I know, but also to that point, it's so interesting because I think that not only is it could be from all those things that you just mentioned environmentally, but then there's some people that have it as a genetic disorder, correct?
Yes.
And even that is sometimes not blatantly obvious to people until maybe they are going down an IVF road and that comes up. How can we help to improve our mitochondria and also get that tested to know, okay, maybe I'm thinking about going down the road of trying to have a baby, or maybe I've been trying and I've had multiple losses. How do I get that checked out to know if there's something going on or not?
So there are tests that functional medicine doctors and people like myself can do. Traditionally, they were called organic acid testing. They're urine tests. I then started doing a test called NutriEval, which is very similar to. It has different metabolites of the urine that can give me an indication of which enzymes might not be turned on properly within your energy pathways. So for like making energy, and there's different types of energy that create energy. So there's carbohydrates, protein, and fat. So we look at your carbohydrate metabolism, your protein, which is your amino acids, and then your fats to see, are we actually converting enzymatically? And if we're not, what vitamin and mineral are we missing? The now I started going into a different test called Therium. That's a new, more up-to-date test of those organic acid tests that I used to do. That's a relatively new test for my clinic. I'm just starting to do it. If people want to learn more about it, you can go check out the website. It's called theriome.com, Theriome. It is a mitochondrial snapshot. It is basically your biochemistry, like what is going on inside your body and where are the blocks? Where can we improve it? And then they do this digital twinning. So they'll look at like where you are now, and then they'll project where your domains will improve if you did the intervention. So we'll get all these interventions of like, different things that you can do, lifestyle, diet, and supplements, and then what it would look like in, I think it's a 3-month digital twinning. So within 3 months, here's the improvements. And I think that could be great for fertility because people probably want a timeline. Like, how long is this going to take? I would say probably a good rule of thumb for women, give it like 3 to 6 months and you can see improvement in egg quality.
That's amazing because I think with men, we're always able to know that within that 72 days, right? We know if we test the sperm now and they do lifestyle changes in diet and exercise supplements, we know we can test that pretty easily. With the egg quality, it's always not easy to do that unless you're actually getting them retrieved and seeing what they look like. So that's awesome news. I would highly recommend people who are not only just over 35, because I see this with all ages, to be honest with you. And that's where I really tell people don't get hung up just on your age because people of all ages deal with all sorts of issues. But it's always good to have more information. So, again, this mitochondria situation, let's just call it to be a little bit lighter, I think is gaining a little more traction. People are starting to pay more attention because it is such an important role in fertility. I'm actually shocked that it isn't something that's spoken about more frequently. So I think the more information people can find out, the better by going to that site and to your site. But what can they do to improve and optimize their mitochondria, even assuming that there's no issue, but like just want to get ahead of it, so to speak, just with age and or fertility health?
Oh, there's a lot you can do. First of all, let's look at your diet. What are you eating? What is on your plate? Because I guarantee you there's probably stuff on there that are probably not good for you, and that might be harming your mitochondria. I am going to say the number one thing I think people are partaking in is alcohol. I think that is probably the worst thing you can consume when you're trying to optimize your health for not only just for fertility, but for longevity. And I've worked with bladder pain patients for almost a decade. And for bladder pain patients, I that's one of the first things I had to remove from their diet was alcohol. It's a toxin. It's a mitochondrial toxin. It's just there's so many bad things about it. It's a hard one because I think a lot of people socially rely on it. But that for me is the number one thing. If you are drinking, even casually on the weekends, and you're trying to get pregnant, that might be the first thing you're going to have to abstain from. Then there's other things like, I would stop snacking because I think that we are probably consuming too much food as in our society, and we're creating a situation known as blood sugar dysregulation. And all that means is not me doesn't mean you're diabetic, but you could become a diabetic if you have blood sugar dysregulation. So one thing I've learned, because I do another test, by the way, I didn't talk about, was a hair tissue mineral analysis. Absolutely love that test. It's the best test ever because it's a little snippet of your hair in the back, and you get like a snapshot of your like metabolically, where are you? Do you have a sluggish thyroid? Do you have blood sugar dysregulation? Is there adrenal dysfunction? Like your
That's so
adrenal
cool.
gland.
You can tell all that just from your hair.
Oh yeah, it's awesome. So I see a lot of people have blood sugar dysregulation. And all that means is they're not utilizing their blood sugar well, and they're developing something known as insulin resistance. Now, you may not be fully insulin resistant, but you could be trending towards that. And one of the main symptoms my younger patients get when they're insulin resistant or trending is hypoglycemia. That's the feeling of being lightheaded and not being able to go long between meals. So if you eat breakfast and you can't go 3 hours or 4 hours and not eat anything without feeling horrible and hangry, you probably have hypoglycemia. And that is one of the early signs of insulin resistance and blood sugar dysregulation. That alone is huge in the fertility world, which is why you might notice some of the more up-to-date clinics like CNY in New York, they will always put patients on a keto diet immediately. And a lot of people do get pregnant when they're on that keto diet. Why? Because they're improving one layer of the problem, which was their blood sugar dysregulation or insulin resistance. So so more of an insulin friendly diet would be what I would recommend.
which is also great for when you're in pregnancy as well. They
Hmm.
often recommend that. So getting ahead of it is great. People who are diagnosed with PCOS often feel like that is the fertility side of it. PCOS is actually a metabolic disorder for those that are listening. And part of why that is because it falls under this insulin resistance and that whole package that Dr. Mandy's talking about. And so fertility is the symptom of that also. So I think across the board, it cannot hurt for you to start watching what you eat as far as if you're going to try to get pregnant or you just want to be healthier and know that you want to use your eggs down the road. This is a great way to start. What about supplements? I see a lot of people that are quite honestly over supplementing because they think that they need to take all these things. But I also know that supplements do help with the mitochondria, and people that are getting therapy for mitochondria health, they do take some supplements as part of their protocol. But again, it's not over supplementing. So I'm curious where that falls with what you know.
So I believe in personalized nutrition. So what I've done over the last few years is I partnered with a compounding company, and I actually compound my supplements for my patients for them. So they get a personalized supplement. So their prenatal is personalized to them and has their name on it. It is absolutely. And so the testing that I do can tell me the dosing, so I can know how much of things that you need. So I don't want to over give supplements because, like, great example, B6 is toxic for people with my bladder condition. If I do like too much B6, I'm going to be screaming in the bathroom in a major flare. So, and if I just took an over-the-counter supplement with a lot of B6, I could see myself in danger. So I always tell people whenever you can, and it's not always available to you, but when available to you, try to get your supplements personalized so that you're taking the right amount. Now, in the fertility, there are some things that are just kind of basic that you absolutely need that are just kind of like covering the bases that I make sure people like choline is super important, right? The right form of folate is super important. My gosh, I saw a prenatal vitamin the other day. One of my friends shared with me, and they still are using folic acid, which is not the right form of folate. You're going to hurt your baby by taking folic acid. You need to use methylfolate or some kind of natural folate, not the synthetic form. So those are the things that, like, if you're going to do the supplements, you want to make sure you're taking the right dose for you and you're taking the right forms of them as well, because not all, forms of certain vitamins are equal. Even in the B12 world, there's hydroxycobalamin and methylcobalamin and cyanocobalamin. There's all of these kinds of cobalamin, and you want to make sure you're taking the right one for you. That's the extra layer of that would be nutrigenomics. That's another test that I do as well when I can check people's genetic. I don't like to call them mutations because they're not really mutations. They're polymorphisms. They're variations. So you might have heard of MTHFR. I think everyone talks about that one, right? Or CBS, or you might have a vitamin D mutation, or you may have, NRF2 or glutathione, or there might be different polymorphisms that you have that you might need a little bit more tweaking to your supplement regimen. So that's what I do is I sit down, I look at your genetics, I look at your testing, and I say, all right, here is what I think you need, and here are the doses that you need. And then I get the compounding company to compound it in a powder. Yay, no more pills. So we put it in a powder and you can throw it in a shake and drink it and be done with the day. And that's what we do.
That's awesome.
Yeah.
Again, I cannot highly recommend that because I also see people who get poor quality supplements and your body's working hard to move through those as well. So you want to get the path of least resistance for your body when you're especially on a fertility journey. So having them tailored to your body specifically and in a powder form sounds glorious on
It
so
is
many
glorious.
levels.
I
Wow.
used to choke down so many pills,
Oh,
and
me too.
oh my gosh, I hated it. I felt like I was felt like an older, like, geriatric person, with the big thing of pills. I'm like, this is not right. So I found this company. It was a miracle because I was like, wow, this is great. I'll just go 2 scoops and boom, done for the day.
That's so
Yeah.
cool. So what brought you to focus on this? What drew you to this?
So my story goes, I had 2 children in my younger years. My first I conceived very quickly on the first try with natural pregnancy. I was 29. And then the second one I had 4 years later, and I noticed that with that one, it took a few more months to get pregnant. So even in my 30s, I started noticing, oh, it wasn't as easy as it was when I was 29. I got divorced, and I developed interstitial cystitis, which is painful bladder syndrome. A lot of your listeners might know about it because it's pretty common amongst women. And that was destroyed my life, basically. And I decided to recreate my my path and my career and became the IC healer. And as I was fixing my bladder, I was fixing other people's bladders. But what's interesting is people were getting pregnant while they were fixing their bladders. And I was like, wow, why are these people getting pregnant? Like, we weren't working on fertility. What is going on here? And one after another, they're getting pregnant. And I'm like, am I doing something? And then I had a few patients come to me for fertility while they had IC. They actually wanted to get pregnant and they got pregnant. I decided, you know what, let me go ahead and branch out and let me go ahead and start doing this because I'm very passionate about the 35, 40 up world. I think that we are not treated properly when we go to fertility and we say we want to do IVF. They kind of look at us like we're crazy. And the first thing they bring up is donor, which I think is unfair. You should give every woman a chance. Just because they're 40 doesn't mean that they have to automatically use a donor egg. Some people choose to, and I don't have any problem with that. I think that's their choice. And I'm sure there's beautiful families that are built that way. And great. But I think that, if you can understand the driver behind what might be causing the infertility, there may be a different conversation happening with you and your doctor if they actually understood how to help you.
100%. I had one doctor that I went into, and he didn't even look at anything other than my age and said that's what I needed to do. I'm like, I just had a baby naturally, like
Yeah.
5 minutes ago, and you're telling me
Yeah.
this.
Yeah.
Of course, I went on to have my children naturally after that, but it was literally just based on the number on the paper that he looked at. And that was really a shame because there's so much room for improvement on so many levels with people that are over 40 that I just hate to hear that doctors are still doing that now, which also leads to the mitochondria donation, which is a whole new other world that's not quite, again, reached the US, but is happening in Europe. And I think that whole movement is going to be something that is really going to change the dynamic of IVF and donor conception as well in a whole different area, which I'm happy to see. It's amazing. The fact that we live in a world that all these things are possible, blows my mind. It's so crazy.
Yeah, I want to mention about that though. The only problem is if you're still unhealthy, like your own mitochondria are not healthy, it's not going to fix the downstream. So you might have a healthy egg and you might conceive, but you can still lose it. And it may not. Like if you have mitochondrial dysfunction, it may not implant. So the
Of
embryo
course,
is
the
totally
same
fine.
thing with a healthy
Same
embryo.
problems.
They still
Yeah.
might not transfer. But the fact that you can actually, that it's possible and they're doing
Yeah.
this and the science is going that direction is incredible to me.
Oh yeah.
I
Yeah.
think we're still a long way off from getting it totally dialed in, but maybe not. Maybe it'll go faster than we expect. But thank you so much for sharing your story and being here today and educating all of us on just basic science as well as the dynamics of how we can improve our own health. It's such great information to have, as well as all the testing. So how can people work with you to find out more about their own health?
Well, I have two ways I started with this. So I traditionally always did a discovery call. So you do a one-on-one discovery call. We kind of get to know each other because, I want to make sure that they're a right fit for me as well. The second way I just started doing is I have a free fertility application. So for people who don't want to do a discovery call, maybe they don't have time on the calendar, or I get a lot of international people, so the time zone doesn't work out. They can apply. It's free. Basically, what they're doing is they're filling out a form. I'm reviewing it, and then I'm sending them an offer with the testing and the pricing to say, hey, I think you're a good fit. Here's what we can do. And that works really well for international people too, because then they don't have to fit into my schedule because my schedule is kind of tight lately because I have an 8-month-old who takes up a lot of my time. So those are the two ways. And I'm also working on an HTMA only page on my website. It's not up yet, but I'm working on it. So if people just want to do the hair tissue mineral analysis by itself, and that's all they want to do, and they don't necessarily want to work one-on-one with me, I'm going to make that happen for you as well. So that will be on my website here in the next couple of weeks as well.
Sounds all like great information. I want to sign up to do all of those things. So I'm always so curious about what's going on with my body these days, even though I'm past the having kids stage, I'm like, I geek out on it. Like I said, when we started this call, I just find it all so fascinating. So thank you so much for being here today. And we look forward to connecting again soon.
Okay. Thank you. It was great meeting you.
Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your friends with fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.